Recording. Okay. Thank you everyone today for joining us today for a webinar that we feel is really important to communicate and to share with you, and that is the topic of ensuring and communicating takeout food safety amid coronavirus. My name is Rebecca Bykowski. I'm a program manager at Sustainable Pittsburgh with the Sustainable Pittsburgh Restaurant Program. Okay, so just a little welcome with some introductions. We are going to, today with us, we have a few people on the line from the Food Safety Division of the Allegheny County Health Department. Ian Anderson, who's the Environmental Health Specialist, he's going to be sharing with us some about COVID-19 and food facilities, some PA Department health orders, some proper cleaning protocol, information on self-service, takeout and delivery precautions. Then I'm going to go ahead and share some information that we've pulled together about safety tips for takeout and delivery during the COVID-19 pandemic. And followed up, we will have Sherree Goldstein, who is the owner of Square Cafe and My Goodness, give some perspective from where she's coming from as a restaurant and shop owner, tips on how she's implemented some things, some examples, lesson learned, and then communications. And we'll follow up with some Q&A, as I'm sure there are probably a lot of questions specifically for the health department. I did mention that outside of Jesse, we have a couple other people on the line. Jesse Sherrard, who's the Environmental Health Administrator, as well as Donna Sharding, the Food Safety Program Manager. And I'll just say, when it comes to putting in any questions, you'll see there should be a black ribbon on your screen, on your panel there, and you'll see a button where it says Q&A. So we will go ahead, any questions that you have, please do go ahead and type them into that Q&A box, and I'll read them off to be answered during the Q&A session at the end of the recording. I do see in here someone did ask if copies of the slides will be made available, and yes, we will be. We're recording this session, so we'll be sharing out the recording as well as the slides too. So feel free, as we're going through, to stick any questions in there and we can get those answered for you. So just a little bit of background on our organization. At Sustainable Pittsburgh, our mission is really all about empowerment. We empower decision-making that builds a fundamentally equitable, resilient, healthy, and prosperous region. We work with hundreds of organizations, universities, communities, local governments, and businesses, ranging from small mom and pop shops to large global companies on a wide range of products that work to advance policy, share expertise, and strategically build professional networks that advance collective impact. Many of you on the call today have engaged with us through our Sustainable Pittsburgh Restaurant Program. Similar to the restaurant program, we also have a program geared towards providing sustainability recognition for retail shops called Sustainable Pittsburgh Shops. Over 165 restaurants and more than 300 small retail shops in the Pittsburgh area have engaged with these programs and earned a sustainable designation. Through these programs, we recognize and champion these businesses for their sustainability commitments, provide them resources to improve, and then also work to build collaborative networks that can support the overall sustainability of the region. In addition to those two programs, another program of relevance is our Sustainable Pennsylvania Community Certification. In that program, we have over 100 certified sustainable communities across the state. And over the last 20 years that we've been in existence, one of our primary roles is being that of a convener. We've also been recognized as a resource and a teacher, and today we're happy to share with you some best practices, tips, and guidance concerning proper safety precautions that restaurants can take amid the COVID crisis. So with that, I'm going to turn it over to Ian, who's going to provide some information from the Allegheny County Health Department.
Hi everybody, my name is Ian Anderson. I've worked for the county for about 2.5, almost 3 years. And I'm just a field inspector. If you own a restaurant or manage a restaurant in Bloomfield, East Liberty, Northside, something like that, you'll see me up in that area for about 2 years. Yeah, other than that, we're just going to go into some basic stuff about COVID. I'm sure everybody's been pretty aware of what's going on, what COVID is. We'll just kind of go into that, some disinfecting and sanitizing procedures, and some takeout and delivery safety things that you should consider while you're, gearing up your restaurant for this. Next slide. So here I found this great picture of someone sneezing, and so the big thing about COVID-19 is the illness you get when you become infected with this coronavirus or SARS-CoV-2, severe acute respiratory syndrome, and then CoV is coronavirus, and 2 is just the designation. So it's spread through droplets and through the air. So you have to breathe this into your lungs, and then you will develop symptoms, or maybe not. We hear a lot about asymptomatic people without the symptoms of coronavirus, just going through the community. There's no vaccine currently available to prevent the infection or to cure you of it. With most viral infections, you have to let your body fight it off as best as possible. And so we can see in this sneezing picture, it's probably a bit more graphic than most people sneezes, but this is kind of showing the importance of wearing these even cloth face masks, which we'll talk about in a little bit, preventing these droplets from getting into the air and floating around your coworkers and everything. And so, there's the important thing right now is that there's no evidence that it's foodborne. So we worry in the food safety program about foodborne illnesses, or illnesses that you get when you consume food that have the illness or you have the bacteria or the virus in that food. Get into your GI tract or something like that. Luckily, COVID-19 or coronavirus is an illness that's respiratory, so it has to get into your lungs for you to become sick from it. So we can't get COVID-19 just by eating the food, which is good. Next one. Or just click it, yeah. But it's still very contagious, and the problem now is that's why, all the dining rooms and things are closed, because it's this person-to-person transmission, and it's not just, coworkers, it's you to the customers, your delivery drivers, your suppliers, your maintenance people, and things like that. Next slide. So, just this hand washing and employee hygiene. Hand washing is important for these foodborne illnesses because, we're worried about contamination of food, getting raw chicken or something on a ready-to-eat food, and then you could become sick from maybe salmonella or something like that. But here we're more worried about, making sure that sick employees don't work, so they're not spreading it through, coughing and sneezing through the air while they're working, or spread it to customers. So it's really important for you monitoring yourself and your employees for symptoms of COVID-19. I think probably everybody's been aware of what the 3 main symptoms are, coughing, shortness of breath, having trouble breathing, and a fever. Next one. And so the hand washing is important, not really to protect the food, since we're not really getting, coronavirus or COVID-19 through the food and making you sick by eating it, but more of preventing contamination of surfaces, or the risk of you getting something on your hands, the COVID-19, the coronavirus, on your hands, touching your face, and then inhaling the virus and it getting into your lungs or someone else's lungs, things like that. That's why it's important to do this running water with soap for 20 seconds. And that's the same amount of time that, we require in food facilities now, just for regular hand washings. Running water, hot water, lather your hands for 10 seconds, 10 to 15 seconds, and then wash it off with water and dry with a paper towel. And so the masks we were talking about, so for reusable cloth masks, we talked about cleaning, and cleaning of these masks could be done daily or when they become damp or dirty, whichever comes first. So, you wear this mask for an 8-10 hour shift, and then they will have to be washed when they go home. It could just be done by hand in their sink, in your employee's sink, in your sink, with just laundry soap, and then hang dried and then used the next day. That's fine. If they become damp, they'll just lose the ability to hold your breath and droplets and things in. Don't reuse non-reusable masks. That one's a little trickier. I have a coworker who works in a hospital, and she's only issued 1 disposable mask a week that she has to reuse. And it can be very difficult. If you have a supply, ideally you're using cloth masks, or you have enough masks that they can be reused, that they can get new ones every day. But you're going to have to do what you have to do to make sure your employees have masks. Next slide. And so a couple of these things, what you as a manager or owner of a restaurant have to do, I'm sure everybody's read the PA Department of Health order from last week, markings on the floor. I'm sure we've seen these all at grocery stores, or maybe you've done it in your own facility, just to help remind people how far away 6 feet is. 6 feet, as humans, we're used to being close to each other. 6 feet apart is very, very far apart for us. And it's just something we have to remember. Like we said, you have to provide masks to all employees. If employees want to bring their own reusable cloth masks from home, or they have their own supply that they'd rather use, that's absolutely fine. But if they're not able to do that, you have to supply them with a mask. And obviously, we're not going through the whole order. I'm sure people have read it, but we're just going to talk about these two, these barriers between employees and the public. We've seen at Giant Eagle that they've put up those plexiglass barriers by the cashier. I've also seen a couple coffee shops where, where you pay for your drink or whatever. They put a table in front of the cash register, so people are reminded how far back to stand. So there's no chance of being less than 6 feet apart. So that's just something you want to think about, and we're talking about takeout and delivery. So hopefully, there'll be enough time, or we're trying to limit contact with customers. So this won't be as big a problem for you, but it might be something if you have a lot of delivery people, Uber Eats, Grubhub, things like that coming in and out. It might be something you want to think about. Next slide. And I'm just going to touch briefly on sanitizing, disinfecting. They are two different things. Remember, when we're talking about sanitizing, this is for food contact surfaces, and that hasn't changed. These are cutting boards, prep tables, utensils, things like that. That concentration of bleach is 50 to 100 parts per million. And that's what we're using our test strips to test, or the quat sanitizer, and it's whatever the manufacturer says, usually 150 to 300 or so. And you can test that with your test strip. But the next one, disinfecting, which we're really worried about for card readers, doorknobs, things like that. These are non-food contact surfaces. So you see bleach, CDC is recommending 1/3 of a cup of bleach per gallon of water to disinfect. And that's about 3,000 parts per million of bleach. That concentration of bleach is so high that it's going to be difficult to get the residue off of a food contact surface. So we want to leave this amount of bleach, this amount for disinfecting, only for high touch non-food surfaces. Needs to sit on there for a minute. It can be a spray bottle or a cloth and bucket. That's fine. You just spray it on, walk away for a minute, spray some other stuff, come back, wipe it off, and you'll be good to go. Next slide. And self-service beverages and other self-service things shouldn't be encouraged. We shouldn't be allowing these to be used. This is mostly, particularly if people are refilling, if they've touched the edge. You can see in this picture, if they're drinking from a cup, that saliva has virus particles and things in it. Drinks and other self-service things should be discontinued and done by employees. Next slide. And just talking about takeout and delivery, I know Rebecca and Sherree are going to talk about this later, so I won't hit too much on it since it's more on the business side. But it's going to be what everybody's been doing, encouraging that prepayment. Trying to do it over the phone, online. If you're able to do Venmo or some other online service, it might help to limit that contact with money or credit cards. Obviously provide curbside pickup. If people can order and pay online and they can just drive up in front of your facility, that'd be great. Or if you're doing delivery, if you employ the delivery drivers, you use Grubhub, that porch drop off will help to limit your employees' exposure to those customers. And so one thing I got a couple questions about is like delivery drivers, and I put cashiers too, but mostly delivery drivers, they do have to wear masks. I know a lot of people don't have a lot of control over, what Grubhub or something like that, their employees, when someone comes in to take an order, but, they need to be wearing masks when they come into your facility. They're going into a lot of different restaurants or interacting with a lot of people, and they're not exempt from the mask wearing guidelines. I think there's one more. And yeah, if possible, if possible, try and provide a little container of hand sanitizer for your for the delivery drivers when they're coming in, they take the orders. And if possible, if you have a restroom that would have been for the dine-in customers that your employees aren't using, but would have been for, the dine-in eating area. Allow them, the drivers to wash their hands at your facility, if possible. And the last slide is just, I can't answer any specific family or medical questions, but they can be directed, even if you don't have insurance or employees don't have insurance or anything like that. They can call this hotline to help be connected with doctors or to answer their questions about COVID-19. It's at 888-856-2774. And I did include my contact information if you want to email me personally or call my desk number.
Hey, Rebecca, you're muted.
Thanks, Meredith. So as I was saying, thank you, Ian, for that presentation. That was super helpful. For anybody who might have come in after we started, if you have any questions, we're going to do a Q&A session later. So go ahead and throw those questions up into the Q&A box. There's a black bar that has some little images on it. One of them will say Q&A. You can go ahead and stick any questions you have in there, and we'll address those later in the presentation. So I'm going to go ahead now and just talk to you all a little bit about some safety tips that we put together for takeout and delivery during this COVID-19 pandemic. A lot of these tips we gathered just from observing what a lot of great examples that we saw happening. We just thought it might be helpful to put them in a type of format that could be easily presented and shared with restaurants and with employees and things like that. So it's been an ongoing work in progress. We do have it put into PDF form that lives on our website, and I have that linked into the presentation later, but I'll just review with you some of those tips that we have for you right now. So our first tip is it's something that Ian touched on, but taking payments online or by phone and not taking payments in-house. By doing this, it's really limiting social interaction and potential contact with any infected surfaces or infected customers that might come in and leading to further exposure of the virus. For tip number 2, scheduling and arranging pickups for takeout and delivery to limit social contact. This can be done in a variety of ways. I've seen people doing it with phone, with some phone ordering system by just emailing the business and providing your contact information. They will email you back. Sherree will talk later about some of the things that she's done to implement this within her store, but you can also arrange it online such that you can order for pickup now or schedule it for later or a delivery, and arrange those pickups within 15-minute spacing such that you're limiting contact. That way you can make sure that only one delivery driver or one customer is entering the space at a time. You're placing these items for pickup on a clean, sanitized area, at least 10 feet from any employee to maintain a safe distance. And something Ian talked about before was consider using tape to create boundaries. It's sometimes hard for us to understand how far those distances can be to keep safe. And another option would be to just also provide customers and delivery drivers with a number to call or text upon arrival. And then they can be given specific instructions, whether it might be to open their trunk or their car door to have the food put in, just to help limit that exposure. So tip number 3 would be to sanitize between pickups. So we all know that it's known that the virus can live on surfaces for days. So being sure to sanitize and disinfect between each customer pickup or pickups for delivery. You're looking at all contact surfaces, doorknobs, handrails, whatever that might be. But just making sure between every pickup to go ahead and keep those items sanitized and disinfected. Tip number 4 is to limit cell phone usage as employees. Cell phones, we all know, are notorious for spreading germs. So one thought is to consider dedicating a small space as a sanitizing area for cell phones. or you could include some wipes and spray cleaner, sanitizer to protect employees and guests and limit usage while employees are on the clock. Tip number 5, and again, something Ian talked about and we all know in the service industry is really important, but of utmost priority right now to encourage and enforce proper hand washing and washing often. This is something obvious, but really important to discuss. After every touch of a cell phone, each customer driver interaction, anything of that nature, you want to encourage and enforce proper hand washing techniques, as this is the most important and useful way to help prevent the spread of the virus. Physical distancing, which we're all really familiar with at this point, but encouraging and enforcing that 6 feet of physical distancing with employees. I know some operators I've talked to, that's been one of the hardest things, is just reminding people of that necessary behavior to physically distance. It's just human nature that dictates that we want to be close to each other, and restaurants are the best spaces to do that. Restaurants are, and the employees and staff within them are oftentimes a lot like family. So it's really important to remind employees of the importance of maintaining a safe physical distance and limiting staff per shift as much as possible in order to maintain that safety protocol. Another thing is to keep staff in dedicated positions. So if you're accepting payments on location, if you're not able to accept payments online, making sure that you have a dedicated staff member that is running the register of the POS system, just to limit the amount of contamination that can go across any touch of the screen or any of the anything else that might be in vicinity. And by keeping these staff in dedicated roles, you're helping to remain safety precautions between staff and customers and minimizing that contact and spread. Wearing masks, another thing Ian also talked about, but providing masks to staff and or requesting that they bring their own in the event that you're not able to provide them. As we all know, the new order by Governor Wolf mandates that all customers and employees are now required to wear masks. And if that's something that, as operators of essential businesses providing food, you're required to offer alternative options for customers. So if someone does come to your business without having a mask, whether it's a customer or a delivery driver, you must provide safe alternative options for them, such as pickup or delivery, where that going back to having a number for them to call and bring the order out to their car. But it's really important to maintain that level of safety with customers and your staff. And something really important that I know there are a lot of businesses that are doing a lot of really great things, but it's really important to communicate your efforts to your customers. People are in fear right now, and they're in fear of safety, and it's likely going to be something that's going to impact the industry for some time. So being able to communicate your diligent efforts to your customers by using signage at your entrances, reminding them of the efforts that you have in place, communicating your efforts that you have instruction for pickup and delivery, using your website, your social media channels, e-blasts to get this information out, and just giving customers confidence that they can order delicious food from your business and still be kept safe. So I mentioned earlier the tips that I was reading from on the left side of the screen there. This is just the front page. We have a 2-pager of those PDF or those tips that I was just reading out on the PDF. There's a link to it over there on the right side of the screen that you can easily download. It also lives on our website at our Sustainable Pittsburgh resources page. So you can find it there, as well as additional resources for your business. And then we also came across from the DIG restaurant group that's based out of New York City. They have, if you check out that enhanced safety protocols, they have some really interesting efforts in place to just talk about how they're stepping up their efforts to keep the restaurants clean and do their part to contain the virus. So some of the things they're doing include safety pre-shifts, using sanitation and warewashing logs, hand washing, usage and changing of gloves. They also address shift coverage, in-house wares, and communications not only to customers, but also vendors. And then also below that are additional procedure and policy resources by DIG that lives on their website. And there are also some really valuable information on there. And lastly, you can follow us on social media if you're not already. We've been putting out a lot of useful information as we come across it on our social media channels, and those icons there are linked right to our channels, but across all channels, we're at SPRPGH, so you can help to stay up to date on information that we find as it comes across. And then my email address is also listed there at the bottom in case you would like to contact me with any specific requests or needs you might have or any other information that might be helpful. And with that, I'm going to pass it over to our friend Sherree Goldstein from Square Cafe, My Goodness, to talk about some of these parts and implementation and what's that's looked like for her businesses.
Hi, thanks for inviting me on, Rebecca. I appreciate it so much. So I own Square Cafe and My Goodness, which opened about a year and a half ago. We're both located in Regent Square on South Braddock Avenue. And as the COVID was striking, we started to make changes immediately. And so the weekend before the closed restaurants, we started online delivery service right from our website portal. And so people can link right onto our website, both stores, and order everything online, pay for it online, and choose a delivery time and or a pickup option. And that initial week, we were able to get masks to all of our employees. And of course, we've increased the usage of gloves and hand washing and sanitizing all surfaces all around all the time. What we've really been able to do is shift from just prepared foods, menu items, to grocery items. So our vendors, our experience is that the vendor has product, unlike some of the grocery stores that have run out of different things. I think since Easter, the hot item has been flour, sugar, baking soda, and yeast. And we've been able to acquire those things by our vendor, and portion them into smaller packages and sell them as retail items. So that's been pretty helpful. We also have some signage at the store that allows people to, we just tell them they need to wear a mask when they come in. And I think that was a little bit of a challenge the first couple days of this week, mostly with Grubhub drivers, not so much with regular customers or the staff. So that's been helpful. We've also been able to just create more verbiage and use our social media all the time. So we are constantly pushing out our delivery areas. We're pushing out what items we might have, what soups may have changed, what menu items may have changed. And we're delivering as far as Cranberry, Trafford, Monroeville, Murraysville, into Plum, and the whole Fox Chapel area, all the way out to Robinson and the whole area of South Hills. It is quite a challenge, and oftentimes we are going to Bloomfield 6 times, like in a half an hour. So we're not really figuring out how to do it efficiently yet, but I have staff that desperately want to work and that are happy to be getting paid. And so we've just shifted everything and kind of made it work. I don't know if there was anything else, Rebecca, you wanted me specifically to mention.
I think that pretty much covers everything. I don't know, there might be some specific questions that some of the participants have for you, but I think that pretty much covers it. You talked about how you've been implementing some things, some challenges that you face. So I think that covers it as far as what I was looking for. Yes. Thank you, Sherree.
Yes.
Okay, so now that we've gone through, we're gonna go ahead and hit up our Q&A session. I do see that we have had maybe a couple questions come through. So if anybody has additional questions, you can feel free to stick them into the Q&A box. And also, Donna Sharding from the Health Department wanted me to let you all know that you can feel free to contact the Health Department with any type of food safety questions if they're not able to get answered today. And you can reach them at foodsafety@alleghenycounty.us. So it looks like we have a question in regard to payments. Says, can you only accept prepayment / do you need to accept cash? Not entirely clear what that means. I'm not sure if the person who asked this question could clarify it for a bit. Is that if you cannot, are you able to accept cash? If you can kind of clarify that for me a bit. Are you looking to know if you're able to accept cash as a business for a payment? That would be helpful.
I'm going to guess that this person is asking, do you have to accept prepayment or can you accept cash?
Okay, I get it. Yes, thank you, Bill Fuller, for also clarifying. So can cash be refused is the question. As far as accepting for payments, I don't know, Donna or Ian, Jesse, if you have any input on that.
I don't think there's any law about not accepting cash. So I think you could, if you didn't want to accept cash, I think you could say that.
Yeah, from my perspective, we try not to turn away any business. We're all gloved. We're all protecting ourselves from the customers, and we're hoping that they're protecting themselves also. So we are still accepting cash, although it's very little.
Ms. Donna, it's just important to remember to wash your hands if you are having cash transactions. If you are not accepting cash, communication is always the most important. Let the customers know up front.
Okay, thank you all for the input there. That was super helpful. So it sounds like just, if you want to make that an internal policy, it's up to you. Okay, next question, Sherree. Who's doing your delivery?
We have one company car, and so we've used that car, and one of my prep cooks has been the primary delivery person, but my managers are also delivering, I'm delivering, and we just hired a new person that will begin delivering this weekend with us and using her own car.
All right, thanks, Sherree. Next question, regarding sourcing for masks. Is there a recommendation for a local source for face masks, and are they in stock? Is that something Ian, Donna, Jesse, you might be able to help answer?
The Restaurant Association does have a link to some suppliers. Whether it's up to date, I couldn't tell you, but it is a good resource.
Okay. Is that the National Restaurant Association or the Pennsylvania Restaurant Lodging Association?
I do know it's on the Pennsylvania Restaurant Lodging Association website. It may also be on the national.
Okay.
And I did hear from a couple of the facilities I've talked to this week that purveyors they work with have masks. I don't want to go spreading rumors. I don't want to name particular purveyors, but if you've got somebody that you work with on a regular basis, a lot of these places seem to have stocked up when the writing was on the wall, and you should be able to get them through some of the big food distributors.
All right, thank you. And I know we've had some discussions with Sustainable Pittsburgh about how we can help in that front too, knowing that there's going to be a need there. So might not have all the answers yet, but we're working on that.
Something else that could be useful is that the CDC has instructions posted on their website about how to make masks from a variety of materials with a bandana and a couple of rubber bands, with a t-shirt that you can cut apart. So there are ways to make reusable cloth masks by CDC recommendations.
We've done it at Square Cafe. We've used old shirts. So most of them have our logo or some kind of graphic on the masks. So one of my cooks is doing them at home. So they're reusable, washable.
Awesome. Okay, next question. Will we have to get a thermometer to take our employees' temperature?
So according to the governor's order, you only need to take employees' temperatures before the start of a shift if one of your employees develops COVID-19. So I guess if one of your employees does get it, they get tested, they're confirmed to have it, then you will need to start a temperature taking procedure with your employees at every start of the shift. So it could be possible that you would need to get one.
Yeah. How can cash be sanitized?
It can't be.
No recommendations for that.
Not a smooth, easily cleanable surface. It's made out of like cotton fiber and paper. It just can't be sanitized. So that's why, like Donna said earlier, the hand washing after you have your cashier or delivery driver handle the money. It's very important for them not to touch their face or anything like that before they wash their hands again.
Would you recommend using gloves when handling the cash and then removing them immediately afterward?
It's possible, but like we teach a lot in class, the gloves are only, again, you could get the virus on your gloves, and then if they touch their face, it's the same problem. In taking the gloves off, there's still a risk of contaminating your hands. So once you take those gloves off, you would still then have to wash your hands. So that's up to them. Obviously, the gloves won't hurt, and maybe it'll remind people to wash their hands more often. But it wouldn't be necessary. The virus isn't going to go through your skin and get you sick that way. It would just, they'd have to handle the cash that would have to be contaminated with the coronavirus and then get it near their face, get it on their face. So that's the thing that would be the hardest thing to worry about.
Okay. Are there any specifications for how to handle employee masks as they're worn throughout the shift? And also, in addition to that, what upper handling procedures should you need to remove a mask? So two-part question. The first part, are there any specifications for how to handle employee masks as they're worn throughout the shift?
I guess the specification would be that, like I said earlier, it would just be, if the mask gets damp or dirty, it would have to be washed. If they're taking it off to eat, they want to handle it by the elastic band that goes around their ear, or however they've tied it to their head. Because you don't want to handle where you've been exhaling. You don't want to handle where you've been breathing in, possibly contaminated the front side of the mask. You just want to take it off, and if you have to use it again that day, just carefully put it back on, wash your hands. If that answers the question.
I think it does, yeah, because you hit on both pieces and handling the procedures if it needs to be removed. Do you recommend to check in temperatures of employees daily?
I mean, if you have like I've seen those forehead thermometers where you don't have to physically have it put in your employee's mouth, because obviously that wouldn't be a good thing either. If you have a forehead thermometer, an infrared one where you could just shine down their forehead and you can get the temperature, I mean, that wouldn't hurt. I don't know how you would do it otherwise. If you have the means to do it, it won't hurt, because you'll be looking for a temperature over 100.4 degrees. And if it's over that, they should be sent home and they should call their healthcare provider.
Okay. What about I know that there's been some talk online I've seen about microwaving face masks to sanitize them. So there was a question that came up about that. Is that a proper way that they could be sanitized, or is that more of just a farce?
I can look that up. I haven't seen anything about that.
I did see that, I think on the news last night. Many of the masks have metal in them, so it could not be recommended.
It's not recommended. You're a little quiet, Donna. Sorry.
Oh, sorry. I did see that on the news. Many of the masks have metal inside them, so it's not recommended.
Yeah. So if it has metal, obviously you don't want to put it in the microwave. I don't know. We can look this up, but I'm not sure.
Okay. And it looks like a couple people have typed in here about ordering some masks on eBay.
Oh, sorry, I was on mute. I was
Oh.
actually just reading the CDC guidelines on sanitizing masks. For a reusable cloth mask, their recommendation is that simple machine washing would be enough. From what I understand, it goes to the structure of the coronavirus, that it has a it's protected by a fatty external layer that is disrupted by the detergents that you'd use in a washing machine, and that kind of washing would be enough for a reusable mask.
Okay. Thank you very much, Jesse. So yeah, I was saying eBay, someone posted in here that they got some from eBay, $40 for 50 of them. And then there was another, Cisco and Pen Fixture have them. However, it was also indicated that they are a little pricey. So another question, what if a volunteer / employee gets COVID? What should the business do?
The procedure is outlined on I believe the CDC website and in the governor's or the Secretary of Health's order. I believe you have to close the facility for 24 hours and then do a thorough disinfecting of the entire facility. You would then have to, I believe it's monitor and check your other employees for symptoms, and then you would have to begin that taking temperatures before every shift of all employees who may have worked in the facility, so they may have come in contact with it. We can get the full guidelines to you. It's on that PDF.
Okay, it looks like there are some questions that popped up in the chat too.
Yeah.
So someone did say Walmart, we believe Walmart still has masks available. Can you expand on whether the coronavirus is tested if someone had coughed or sneezed near the food during food prep?
Well, I mean, it can be ingested, but if you do ingest it, there's no evidence that you would get COVID-19 from ingesting it. Since it's a respiratory illness, it has to get into the lungs. If you're ingesting it, it's just going to go down your esophagus into your stomach and then your GI tract and everything, which is different than like norovirus, which if you do ingest it, you would get it. But coronavirus, it doesn't behave that way. So you'd have to breathe it in.
Thanks, Ian. Is there an effort to expand testing to food service workers in the same way that healthcare workers are prioritized?
I haven't heard anything about that.
I have not either. That's a great question.
It's a good idea, but yeah.
It is. I agree. Someone says, I thought I heard that we should only be concerned if inhaled, but it just seems that ingestion would be an issue as well. And I think that's something that you just addressed in that other question. Are we legally covered in terms of requiring customers to wear masks? Are gloves required for employees too?
I can't answer legal questions.
Yeah. Not entirely sure of that either. Do we have to shut down and clean our shops if somebody turns up sick? Just symptoms or a confirmed test?
Wait, sorry. Do we have to shut down?
Do we have to shut down and clean our shops if somebody turns up sick? And I think that they're also asking if that person is just showing symptoms or a confirmed test.
That's a good question. I don't want to say it wrong. We'll send it. Yeah, there's right below that from Donna is secretary's orders, and that has it outlined about what you need to do when someone shows up sick. I would read
Oh, great. Yeah, that is in the chat window for
Yeah.
everyone.
that governor.pa.gov.
I did want to mention, this is Donna, that the health department contacts people and gives instructions. So if somebody does show up sick, we would be contacting the food facility as well to provide instruction.
Yeah. So we would be contacting them and you if someone that works at your restaurant becomes sick.
Okay, thank you. That's helpful. What is the definition of disinfecting after an employee turns up positive? Does a person have to hire a cleaning company, or is that something that could be done in-house?
I believe you can just do it in-house. You would just have to do that at least 1/3 of a cup of bleach per gallon of water if you want to use bleach. There's other EPA-approved disinfectants that you could use. There's a list on the EPA website that you can get through from the CDC website. You can use those also. You would just have to, you'd want to definitely wear the correct, masks, gloves. You'd probably want to find a non-reusable mask, a disposable grade mask, and then you would have to wipe down every surface and things like that.
Yeah, also,
Yeah. Oh, sorry.
sorry.
Yeah, but I don't think there's no requirement to hire a cleaning company.
So there's also a link, just so everyone's aware, in the chat. We had a participant that slipped in a link for the masks that are available at Walmart. And Donna, looks like Donna also put in within the chat box some cloth mask guidance provided by the CDC. So a couple of things there to check out too, where face masks are concerned. I think we answered that question. Is there something the delivery driver, or is there something the delivery people should do to their cars to deliver, I guess, to sanitize for deliveries?
Probably just the high touch surfaces. They'd want to probably do their maybe inside and outside door handles, the steering wheel, the shifter. They probably want to, if they have a spray bottle of, bleach, or if they have, some Clorox disinfectant or something like that, that probably wouldn't hurt. I wouldn't be too worried about the cloth seats or the seats or whatever, because you're not going to be, you're probably not going to be touching those very much. I think it's more important is just making sure they washing their hands in between that. And, if these deliveries are already, in paper bags or in plastic bags or whatever, they're not really coming in contact with the food. So that's a good sign.
Okay. And just looks like some insight that popped up in here about requirements from the state. It's requiring businesses to insist on customers wearing masks unless they are unable. If they are unable to wear masks, businesses are required to find a way to serve customers outside the business. So this would then legally protect you when insisting that they wear a mask. Okay, it looks like we do not have any other questions that have popped up. If anyone has any last minute burning questions, go ahead and throw them up now. Okay. So it looks like we have no more questions at this point, so we can go ahead and wrap up a few minutes early here. Again, we'll be sharing this recording as well as the slides with all participants and some links to some other resources. If you have specific questions for the health department, again, just a reminder, food safety at AlleghenyCounty.us is where you can shoot those to if there's anything that comes up after this session that comes to mind. And again, if there's anything that comes to your mind that we can help with at Sustainable Pittsburgh, outside of what we're already doing, whether it's specific asks or ideas that you have, we're all ears, and just trying to be a resource for you the best that we can right now. So thank you all very much for attending today. Thank you, Ian and Donna and Jesse and Sherree for all your valuable information. Thanks to Meredith for your help today in running this webinar. And I wish you all well and stay safe, and I hope to see you all soon. Thank you very much.